Good evening, everyone. Welcome to Bio Vanguard Cell Talk presentation round 4. For today's presentation, Lenford is our presenter and he will be discussing on the topic barriers to healthcare access among female youths in Mozambique, a mixed effects and spatial analysis using DHS 2022-2023 data. Before starting the presentation, I would like to introduce Lenford. Lenford holds a Master's of Arts in Human Rights, Governance and Development, as well as a Master's degree in Social Work and Community Development from the University of Zambia. He is currently pursuing a PhD in Developmental Studies. Through this fellowship, he aspires to acquire advanced scientific and research skills that will enhance his knowledge base, ultimately enabling him to contribute to high impact scholarly publications. I welcome Lenford to start his presentation.
Okay, thank you so much, and welcome to this presentation. My presentation topic for today is titled Barriers to Healthcare Access Among Female Youths in Mozambique, a Mixed Effects and Spatial Analysis using DHS 2022 and 2023 data. Okay, so this study looks at healthcare and some of the barriers that individuals face in accessing healthcare services. And in this study, access to healthcare has been defined as the ability to obtain timely, affordable, and appropriate healthcare services when needed. Healthcare services, or rather access to healthcare, has rather been linked to health and well-being, and that it has always been recognized globally as a fundamental human right. The importance of access to healthcare is that it ensures early diagnosis and treatment of several illnesses. The other importance is that it reduces mortality rates and improves quality of life and supports economic and social development amongst different regions. And there are several crucial components to access to healthcare, which includes coverage, service availability, qualified of the healthcare personnel, promptness to accessing services, as well as geographic or proximity to from where the facilities are, as well as the absence of cultural and informational barriers for individuals that would want to access healthcare services. So there is need to make sure that there is no cultural and informational barriers that would hinder them from acquiring those services. Okay, so the WHO has the commitment to universal coverage of healthcare services and ultimately trying to meet the Sustainable Development Goal 3.8, that is the universal health coverage. But however, there's been, despite this commitment, there's been a lot of challenges and disparities in regions, especially for low and medium income countries, where some of the challenges that have been highlighted, there are those to do with geographical barriers, some to do with financial constraints, and those to do with healthcare workforce shortages and infrastructural deficiencies, because you'd find that most of areas, especially in the rural areas, you'd find they do not have where they can access the healthcare services from. So this has also hindered most of the services as being accessed by most individuals. Coming to the literature, over 7.3 billion people have access to some healthcare services, and more than half of this number, they lack these essential services, which has contributed to significant health inequalities and poorer health amongst individuals. And this has also exacerbated in low and medium income countries, where around about 8.6 million excess deaths has always been linked to healthcare access and the quality of these health care services. And these statistics were actually reported in 2026. And in sub-Saharan Africa, this is where there's this problem where there's a lot of challenges, especially for those that are living in the rural areas, with about 42.6% of the population having access to these healthcare services. The WHO promotes the universal health coverage, but however, in as much as they are trying to commit to meeting up this universal coverage of healthcare, there are some barriers that have been there to hinder most individuals in accessing these healthcare services. Therefore, World Health Organization has defined a youth as individuals aged between 15 and 24. And most of the challenges that they have faced, they are those to do with early pregnancies, because most of the youths at this age, they are exposed to a lot of issues, and early pregnancies are one of the challenges that they tend to encounter, and childbirth, which comes with a lot of complications, because looking at the age, and about 12 million adolescent births annually, this has also been a challenge, because you'd find that most of these children, they become pregnant, they fall pregnant, but they are unable to access these services based on either geographical challenges or financial constraints, and some of it leads to inadequate education, and some goes to gender-based violence, which has also affected their access to healthcare. And also the lack of contraceptive has also been reported to be one of the contributing factors to the challenges for them to access healthcare services. And lacking of these contraceptives, which acts as a control measure, has also led to these young women to fall pregnant and unable to access these healthcare services that would actually help them to become healthy. And some of the barriers that have been reported in low and medium income countries, are those to do with maternal age, like I mentioned, education, the levels of education of the young adults that are accessing these services, also the socioeconomic status, and also their place of residence, that is in rural areas. Those that stay in the rural areas usually face the most difficult challenges in accessing these services, because most of the facilities, they are not near them as compared to those that are living in the urban areas. Also, some is due to limited media exposure, because they lack information on what is trending, as it has been with other countries where you have media close to you, especially those that are in the urban areas. Therefore, the significance of this study is to identify barriers to healthcare access in Mozambique, and also it provides evidence-based recommendations for policy and intervention, and also aims to improve health equity, and especially for the female youths. This study utilized the Mozambique Demographic and Health Survey data, which was from 2022 and 2023. And this study was undertaken in Mozambique, Eastern African. The data that was used is basically secondary data that was being analyzed, and the population was the data set that was actually being analyzed was that from Mozambique Demographic Health Survey. And from the Demographic Health Survey, it's got a number of data that it records. But however, this study's focus was on the women's data set, which accounted for about 5,743 female youths with the ages of between 15 to 24. This study also used a two-stage stratified sampling design, which the first stage looked at as the selection of 619 enumeration areas that was segregated into two, which is the urban areas and also the rural areas. The urban areas was 228 and 391 rural areas, and stage two was also used in order to select the household. Data analysis was analyzed using Stata package to extract and code some of the data that were extracted from the DHS, and also the geographical geospatial analysis was also employed in this study to analyze the data. And most of the findings that were recorded in this study was that the barriers to access, about 49.1% of participants faced at least one barrier to healthcare access, as it was reported in this study. And most of the barriers that were indicated were those to do with financial constraints, distance to healthcare facilities, which talks to the proximity and the geographical constraints. Also, permission to seek care and as well as reluctance to go alone, because maybe the facilities where they need to access these healthcare services was far away from their residence. Okay. An analysis was also done in order to pinpoint the hotspots of where some of the regions that faced healthcare access amongst the female youths, and some of these were distributed according to regions, and it was identified that southern Manica and southern Niassa and northern Zambezia and parts of Nampula were the most hotspots in terms of barriers to healthcare access among the female youths in Mozambique, and those that from Tete and Gaza, these had code spots with a confidence level of 99%. So as it has been reported, spatial clustering reviewed regional disparities in healthcare access, and significant hotspots were found to be southern Manica and southern Niassa and northern Zambezia and western and southern eastern Nampula. Code spots which were low barriers were also Maputo City and Maputo province, which are parts of Tete, and the SATCAN analysis identified 242 significant clusters with the highest risk areas concentrated in Niassa and Zambezia, and as well as Nampula. So this map also indicates the barriers that were faced by the female youths in terms of accessing healthcare services in 2022 and 2023 data that was analyzed, and it was reviewed that Tete and Cabo Delgado they faced fewer challenges than compared to Manica, Niassa, and Zambezia. And the key determinants for these healthcare barriers it included age, education for education that these female youths had attained, also the marital status, the socio-economic status, and also the geographical location where the female youths were residing in relation to the distance to where the facilities of these healthcare services can be obtained. Statistical modeling findings also indicated that the youths who were aged between 20 to 24 were likely to face barriers than those that were aged between 15 to 19. And also education had also been a contributing factor. And in this study, it indicated that those female youths that had no formal education had higher odds of facing these barriers compared to those with higher education. And this is as a result of not knowing what to do in order to access these services. The wealth index was also one of the key factors in which youths from poor and middle income households faced more healthcare barriers than those who were coming from wealthier families. Also, the marital status of youths had also 1.2 times higher odds of experiencing barriers than single youths. So, as it was also indicated in the previous discussion, that geographical factors of female youths in rural areas had 3 times higher odds of facing barriers. And those from the map, we'd have seen that those in Niassa, Zambezia, and Manica were at higher risk, which were also recorded as hotspots, while Cabo and Delgado and Tete had lower risks, which were code risk factors in terms of healthcare access. So this study highlighted the law of socioeconomic disparities, education levels, and geographical location of healthcare access. And these findings, they aligned with similar studies that were undertaken in some African countries, which looked at disparities that most of these countries experienced in terms of accessing these healthcare services. And it has also been recommended that structural reforms, improved healthcare financing, and targeted interventions were necessary to bridge these gaps amongst the youths in these regions in terms of accessing healthcare services. Our policies should also be directed at reducing financial barriers, also improving healthcare infrastructure in rural areas, and promoting education to empower youths who were actually facing challenges in terms of accessing healthcare services in Mozambique. In conclusion, targeted intervention addressing financial constraints and education opportunities, infrastructure development, and gender equity are more crucial for improving healthcare services in Mozambique, particularly in regions which were pronounced to be hotspots. The recommendations were that targeted interventions, which is focused on high barrier regions, those that we have seen that were reported to be hotspots, such as Manica, Zambezia, and Nampula, they need to have targeted intervention in order to minimize some of these barriers and enhance the health access of individuals, especially those that are coming from the rural areas. Also, economic and educational improvement to enhance financial support and educational access has also been one of the key recommendations, and the infrastructure development to healthcare facilities. This is in order to improve healthcare facility accessibility for those that need to access these healthcare facilities, and be able to promote universal health coverage. Gender equity initiatives is also one of the recommendations, and this is to address social and cultural barriers that exist between the people that are living in the rural areas and those that are coming from the urban areas, to bridge these barriers through healthcare. So thank you so much, and this has been my presentation.
Thank you, Lenford. Thank you for your presentation. So, audience, now the floor is open, and if you have any queries, you can type in the chat box. Yeah, I think there were no questions. So, thank you, Lenford. Thank you for your presentation, and I thank everyone for attending the presentation.
Thank you so much.